everybody. My name is Stephanie Arrington. I'm a licensed veterinary technician. I work at the Franklin County Humane Society. I also run a nonprofit, TNR SWVA. I worked as a licensed technician in private practice for about 10 years, but we worked with a lot of shelters, and shelter medicine is just my passion and what I really love to do. So I went through the master's program at the University of Florida for shelter medicine and have been at the Humane Society that I work at for about 5 years now. And just knowing how many cats come into shelters, especially the unsocial ones, and the amount of kittens that come in with chronic issues and some never make it out alive, is the reason why I started really doing a lot of TNR on my own, and then just pushed to get a nonprofit going to try to get some assistance so I wasn't paying for it out of my pocket all the time. But we'll get started, and feel free to ask any questions if you have any. And I can post my email or phone number in the chat if anybody has any questions or needs any resources after the conversation.
Thank you.
Okay. Okay, are y'all able to see that?
Yes.
Okay. All right, so we're going to get started with kitten care in shelters. I'm just going to touch on some of the basic necessities, and then we'll go into some ideas and ways to help animals or the cats in the shelter. But these are ones that I feel like I see a lot with shelters and people who need help, either fostering or people who find them. A lot of people on social media asking for help. So some of these are simple ways as shelter employees, but also private people who are just trying to care for these little kittens and mama cats as well, for ways that we can help make their quality of life better. So most importantly is, where is the mother? Everybody in the shelter knows when they come to me with questions about kittens, the first thing I'm going to ask is, well, where is mom? If we don't have mom, we're not really helping the cycle of what we may intake next year. We're also going to talk a little bit about blood glucose support, body temperatures and hydration regulating, intake and weight monitoring, and then, of course, finding fosters and volunteers and really cherishing them. So where's mom? Always dig a little bit deeper where the mother is. A lot of times this is a question that either the people know the answer to and they want to bring her in as well, or they are a little bit reluctant to go down that rabbit hole because there's a lot more cats at that location. Having someone with TNR or trap, neuter, return knowledge within your shelter, or a resource that you can become friends with or work with, is a real true asset to keeping moms from having more kittens, or even, the males reproducing, to prevent more kittens from coming in the shelter later on. It's also a good idea to always offer like a fostering situation with some people bringing kittens into the shelter. Some may just not know what to do, as far as they found these kittens and they're just bringing them in because that's the only thing they know. But offering fostering resources, or helping them through this transition, maybe they would keep the cats or the mom and the kittens for a while, so that you're not having to, if you have to euthanize for space or push out some of the cats or turn them away, maybe you could balance that with keeping the mom and the kittens in the foster home. And one thing that we really like to do, especially if the moms are not very social or actually, pretty feral, we try to have an agreement or come to an agreement with these people of, we will help you get the mother spayed after she has weaned the kittens if you will take her back. And whether that means agreeing to cover the spay, foster the mom and the kittens until she has weaned the babies, or even helping with food resources after she goes back. And then, of course, always ask more than the person tells. It is like I always know I'm getting myself into a deeper situation when I start asking questions. But if you can get those questions answered and develop like a working relationship with these people, you may stumble up onto a large group of cats, but that you can control that by go ahead and just facing the music and working on trap neuter return or taking in some of the animals into your shelter and get it under control now versus a year from now they bring you twice as many kittens and twice as many adult cats. Spicy moms need love too. These are just a couple of the mamas that I've been out doing TNR at, that the people call me and the babies are born and they're so small, and it's always a long story to it, and you can't take neonate kittens away from their mother. So basically you're going to have to commit to housing them, which is pretty easy to do, especially a mom versus no mom. I feel like even if she's a little bit spicy, if you can take the mom and keep her with the kittens, she's doing the work. You're just providing the food and the care and cleaning up, but she's keeping these little ones alive. And if you've got any involvement with kittens, you know how hard it is to keep babies alive. So going over to blood glucose support, kittens that are not eating on their own, such as bottle babies or just sicklies, um, maybe they're not well, they're unthrifty, maybe they've been somewhere where they've been fed stuff that their body's not digesting properly. Supportive care should always be considered, and keeping that blood sugar up is very important. So these are just some options that I found on the internet that is easily and readily available for you. You don't have to have a prescription for. The bottles that you see, we buy those and then fill those up with Karo syrup and send those with every foster that we've got that has cats or more so younger kittens. And we advise them to put a little bit of that Karo on their gums a couple times a day or at least before bed, especially if they're not eating well. If they're not eating well, we even recommend more often administration. I stumbled across that under the weather gel a couple years ago. I was just looking for vitamins and nutrients for kittens that may help overall well-being, because we all know how sick they get. And this stuff has just been a game changer. It's kind of thick. It's a little bit difficult to get out of the tube, but we put like a 3 cc syringe up against the front of the tube, like where the gel would come out, and just draw it out in 3 cc syringes. And we pass those out to fosters as well, or even in the shelter, if we've got one or two that may not eat well out of a litter, we go ahead and just start them on this under the weather gel. Um, you will find that some kittens really enjoy it. They like to eat it on its own. We put it on a flat plate and they will lick it off or lick it off your finger. So as you see, that's just a general demonstration of using those little Boston Round um, bottles to administer the Karo syrup. You just want to rub it along the gum line. Some people put it on their finger and rub it on the gum. It really depends on how mouthy the kittens are. If they don't mind it and you don't mind rubbing your finger on their gums, that's fine. I do try to keep vials specific for each litter or each kitten. So if you've got quite a few litters of kittens, I wouldn't go from cage to cage to cage administering that, just so that you're keeping the risk of spreading any diseases down. So body temperature regulating and hydration regulating, a kitten's normal body temperature depends on their age, and it can range from 97 to 102. Definitely consider this as like blood sugar and body temperature are the most important things that you want to regulate and that you can do, that anybody can do, any staff member, any volunteer, just to keep an eye on them. We do use heating pads because they're a little bit less expensive than a lot of like the snuggle safes and things, even though those are wonderful. But when we use the heating pads, we do place a layer of blankets between the heating pad and the kitten so that they can get off of them. Now, if you've got a kitten that's not moving around much, that's going to be on you to rotate them so that they're able to move away from the heat if they need to. Um, Making a nest, I think I've got a picture of one where you can roll up some blankets around the heating center, and then if they need to, they can climb over the little edges of the nest, but also the nest kind of holds more heat in. Room temperature, this is really important at our place, and it's something that we're always having to remember. Part of our shelter stays really hot and part of it stays really cold. Of course, what we call our maternity room is when the air is running, it's like a refrigerator in there. The vents blow right under the cage banks, and it's right where we have little bitty kittens. So we're constantly having to cut that down. And in the rest of the building, some of the staff is sweating, but that's just what we've got to do. So just keep that in mind. Pay attention to your surroundings. You may not think it's cold, but consider how cold it is and think of them because they really cannot regulate their body temperatures when they're really young. Fluid therapy can save lives. It does have to be administered correctly, but also gently. I've seen a lot of places use really large gauge needles and really cold fluids and just give as much as they can. I don't believe in that, and I don't recommend that. I think you can get just as much in them and do it a lot more peacefully if you're given sub-Q fluids. With instead of the bag of fluids hanging up, you can use like a 20 cc syringe with maybe a 22 gauge needle on it. If you're giving fluids to like a 2 or 3 pound kitten, depending on how much you're giving at once, that may depend on how much the cat weighs. So I would say right here I put 30 to 60 cc's sub-Q once a day for 2 days. After that, I would suggest getting the pet an IV catheter. Some people like to give fluids more often, but it can be traumatizing for them, and their bodies may not absorb it properly if you're continuing to do sub-Q fluids. At the clinic where I'm at, it's a clinic and the Humane Society all in one. I'm used to putting in catheters in little babies, like 2 to 3 pounds. Some people are not comfortable with that. So if you work with different vets or LVTs, check and see if you've got some that are more familiar with neonates or catheter placements in really small veins. Even some people who work with reptiles, or exotic pets, their veins are super small. So those might be the people you may want to just have in your corner or have somebody to help you with catheter placement. This is just an example of a rice sock nest like I was talking about. So you would place, make your center and then drape your blanket over it. This is my cat Ushi, who's much bigger than a kitten, but as you can see, she's showing us an example of how you sit in the middle of it. This is a chart that I would suggest saving or either just going online and finding it. You can Google kitten feeding chart and weight chart. We use this every year for our kittens, and we put it in our foster bags so that they've got it. But it is really important to try to follow by a feeding chart, and you're not just either giving a little bit and thinking, oh, well, it got some. It's really important to measure because you can also overfeed them and it can make them vomit, and that could lead to them to get like aspiration pneumonia. So following something like this is really important, and passing it out to anyone and everyone who's involved with the kittens is also really important. So we created a health tracking form at the shelter I work at. We pass these out to not just the kittens, but anything that's there that may not be eating well, or maybe we're concerned about like kittens that may not be having a bowel movement properly. So we can track this. They initial in the columns like AM or PM, or they can also write in what they got them to eat, so that we can just look at it as we're walking by the cages and know exactly how they're feeling or if we're making any improvement. We also come up with an animal profile wellness log. This is great because I'll show you in just a minute, but some cats don't mind eating out of a bowl, but you may get a little kitten who's still learning the transition phase of nursing on mom, and now mom's not there, and now they're in a shelter and they were getting bottle fed, and now they're getting syringe fed, and then transitioning to that plate can be a huge thing for them. And it may not seem like much to us, but that learning curve is really hard for them sometimes. So this is where it's nice to have some volunteers or fosters or anyone that can take that time with the kittens, and maybe put a little bit on your finger and dab it from the plate to their mouth, and then get their mouth closer to the plate so they learn that they can eat off of a plate. But circling or highlighting what at that time that they're eating off of, or what they're eating, this is really important too. You get some kittens that come in and they take KMR right away, and some are like, you know what, this is not mom's milk. I will starve before I eat this. So little notes like this can go a long way because each kitten is different. And of course, fosters and volunteers, those are your greatest asset. They may be a little needy and they may ask you a million questions, but I can guarantee it's probably because they just want what's best for the kittens that are in their care. I recommend really getting out on your social media and sharing that you need help. Even if you don't really want a lot of people involved in the actual shelter, share it anyway, because this is how word gets out. And you may attract somebody who has other friends that may see how much they're doing, and they could bring their friends along. Shelter open house is a great way for the public to see just how full you are when you are just overloaded. Even if you don't have a physical shelter open house, you could have like a virtual open house and do like some type of live video where you walk through and just show all the residents, show all the staff, so that people can really see how hard of a job that we have working in shelters. Volunteer opportunities. This is a really good idea for people that have the ability to make flyers or reach out to certain groups on Facebook, like homeschool moms, or teachers that are out for the summer, students that are out for the summer, businesses that are pet friendly. If you can supply a condo, litter box, food, water, things like that, and they just have to set them up and have somebody to clean and feed them a couple times a day, if they're having people come in and out of that business, that may be a great way to get exposure for those cats, possibly get them adopted, or even get more people to help you in your shelter. We sometimes get kitten nannies, which is basically just a volunteer that will come in from like 10 to 3 during the day, especially when we're really bombarded with kitten season. And she basically walks around and feeds all the kittens, weighs the kittens, looks at them. She knows them. So if she sees like their stool looks worse, or they're not acting themselves, or they're not playing, she comes and finds one of us in the clinic. So, create a support system, help them help you, which means saving more lives. So foster concepts, every foster should take a foster kit and have a person to contact for questions. This is where it's really difficult because you've got some people who are in the shelter staff who are willing to be that person of communication, and there are some people that are not, and that's okay. You could use Facebook Messenger. There are lots of apps where you can use so that you don't have to look at it right away. You could even use a telephone with a different line that you could carry or hand off, just like someone being on call. Most of the time that's volunteer effort, so just keep that in mind, but it may save you the trouble of having the emergency clinic call you at 3 a.m. saying, I've got a foster here with a kitten that's dying. So just keep that in mind. I would recommend that fosters be somewhat trained, and that can be as little as requiring them to come in and sit for 30 minutes and watch a kitten lady video, or show them how that kitten that they want to foster likes certain foods so that they know exactly what you're asking of them. I do recommend that all pets that people who are maybe fostering, their pets in their homes really should be altered and vaccinated. We've had some people that have had dogs that were not vaccinated, and then they brought a parvo puppy home. So just keep that in mind. It even offer to vaccinate their pets if you have a clinic or vaccine availability in your facility. Great resource. Again, Kitten Lady videos, they're wonderful. Create a Facebook page. We have a volunteer foster page, and it's a good way for people to share the pictures of the kittens, show their updates, ask questions, even communicate with others. It's a nice place for us when somebody may be going out of town for a couple of weeks for vacation and they have fosters, but they don't really want to bring them back to the shelter. They'll post on there, could anyone watch them? And that's a really great way because most of the time another foster may speak up and take them just for that short term. And be supportive of fosters. Again, they are the ones helping us help the animals. So foster care kits, these are just some of the items that I like to keep in our kits. We get the like 99 cent or $1.99 reusable bags and just fill them up. Digital scale, that's something you'll see on a later slide. I ask for on our Amazon wish list. Weight is another important thing where you can really tell if an animal is declining, or a kitten at least, because they are so small. A change of a couple ounces or a few grams if they're neonate can really tell us quickly if their health is declining. So I would ask for or pack a digital kitchen scale that has grams or ounces measurements, KMR, syringes, miracle nipples. That's another one, top of my list for a wish list. Please ask for miracle nipples. They are much better than the long syringes that you can go and buy at Walmart that you could feed a squirrel with. Canned kitten food, dry kitten food, if you've got really picky eaters, I know it's way more expensive, but the Royal Canin mother baby moose type food is great for helping them during that transition of learning to wean into canned food. So maybe add that to your wish list as well. Litter is always nice to offer to your fosters because you know this stuff gets expensive, and if you can get donations of it, just pass it along to the people that are helping you. I have read before, and I didn't see it up until a couple of years ago, but clumping litter, kittens will try to eat it. They get interested in it. It's got scents. It's got chemicals in it that they find attractive. We had a whole like slew of kittens that all of a sudden started vomiting, and we now use the pine pellets because that's cheaper, and you can buy it in the equine section at Tractor Supply for like $5 a bag. So check that out. Um, but they were all about the same age, and they were somebody had donated clumping litter, and that's what the girls had used in their litter boxes, and these kittens were just eating it like it was candy, and it was just making them all throw up. So just keep that in mind because they really will. Short-sided litter boxes, also remember, you know, they've got little legs. They will try to use the litter box. They're very good, and you know, their natural instinct is to find somewhere to scratch. You can use like the serving platters that are about 16 inches at the Dollar Tree. They're plastic. Those are great. Their sides are very minimal, but also like the cardboard boxes that canned food comes in, and then you just collect a bunch of them, hand them out, and they can toss them every day. Flat dishes and plates, we'll talk about that in just a minute. Heating sources, snuggle safes are wonderful if people will donate them, but rice socks are also an inexpensive way to keep heat in the kennels or the cages or even in the foster homes.
Actually had the nerve to say, I had a great day today, and now you're giving.
And then saline drops are something that you don't have to have a prescription for. You can go find the little remedies in the pharmacy section at like in the children's section of medicines, you can use these, pass these out as well. If they've got runny noses, they've got congestion, start them on the drops so that they are not, they're not getting anything, at least until they can be seen. So how can we improve their care? We've talked about body temperature, we've talked about blood glucose, and eating an appropriate amount for size. That follows along with the feeding chart that you really should be following. But also think like a cat. We always try to make it like us or what we would like, but to really get on their level and to figure out how we can help them the most, we really do have to think like they would think. And we know that they're very high stress creatures, but also they don't like to eat out of deep dishes. There is a true thing called whisker fatigue. So just keep that in mind. If you've got a bunch of the stainless steel bowls that they have to put their face way down in, they may not understand the eating concept yet. We've talked about that. We always try to make like a slurry where you add a little bit of warm water. Even if you've got an adult cat that may not be eating well, some warm water does increase the aroma, which might help them to eat a little bit better. Some like privacy, which I'll show you some pictures of some ideas, but especially the nursing moms or the really scared moms or even scared kittens, they don't understand why there's a bunch of other animals around. So that might help them eat a little bit better if you've got them somewhat enclosed or covered so that they're not so scared. Overbearing sounds, smells, again, it's kind of inevitable in some shelters, and I get that. They're going to hear dogs bark. There's going to be other sounds. The metal cage doors are really loud. All those things can really just send their stress level higher and higher. So maybe think about that. If you've got a really scared animal, try to move it as far away from that noise as possible. We use white noise machines in our different sections of our shelter, like in our surgery room. We cut that on in the cat room where we get them to stay for surgery, so that is somewhat going, because it's a cinder block wall, but that on the other side of the cinder block wall is where
I think we lost Stephanie. Or she muted herself somehow.
are you there?
Yes.
Okay, it just popped up and said this meeting is being recorded, so I don't know what's going on. Let me see. Let me get back to where I was. Overbearing sounds and smells. Keep that in mind. Just think about that. Even if you've got cages beside a sink, if you've got a really scared cat, the noise of the water cutting on and off, or we've got these old trash cans that the hinges doesn't work on one of them. So when we open it up, you press it with your foot, which is great. You're not touching it with your hands, but where the spring doesn't work properly, if you take your foot off of it, it slams really loud. And that can just, you wouldn't even think, but it can really be stressful for them. So keep things like that in mind. Maybe walk through your clinic or give someone that job of saying, okay, let's fix 3 things that could be very stressful in the shelter and make it cozy for them. They need that extra soft and the extra warmth to help them stay comfortable. And of course, enrichment, we could talk about that all night.
Hey, Stephanie, we lost your screen, so you might have to share again.
Okay.
There we go.
Okay. Sorry about that.
Okay.
So these are just some ideas that I wanted to share with you that I kind of try on a daily basis. We've got some kittens that, again, they're in that transition phase, or maybe they've been sick and they were eating, but now they're not. Maybe they had diarrhea and they're just not really feeling good. One thing that I've tried to, and it seems to be helpful for some, not all, but instead of leaving the dry food in the bowl, just pick a few kibbles out and lay it flat on their blanket right next to them. Maybe move them around with your finger, make a little noise so they notice it. But sometimes that helps them focus on the food and maybe take it in and be attracted to it. The plates, like I was talking about, I literally go to the thrift store down the street and buy a bunch of the little saucers like this for like 25 cents. And we use those. I'm not sure if you're, depending on the shelters and your rules, what bowls you might have to have. But if you're dealing with neonates or little ones, or even adults that are not eating well out of the bowls, or they just seem like they want to eat, but they kind of step away, I would at least keep some on hand and try it, because this has made a world of difference for these little guys. They really like the flat dishes. And again, they're super inexpensive. You can wash them, or you could toss them if you want, or send them with your fosters. We've done that before. And then as far as like the kitties that are nervous or do have some visual stimulation that you kind of want to cut back on that some, we had made a post on our foster Facebook page asking about cage curtains, and we put a link up about how to make them. And we had 2 or 3 people, relatives of fosters, that made us a bunch of these cage curtains. So they've got like an elastic band with a button, and you can hook it on one side and then string it along to the other side. Those are great for when you've got to set up the metal cages or condos and you want to cover some sides. That's a really nice way to do it. You can even spritz like the inside or the outside, depending on if you've got more cages beside them, with Feel Away. So they have some smell enrichment. So the picture with the bed in it, that's just thinking about keeping their comfort. Rolling up that bed kind of gives them somewhere to nest into. Adding a couple of stuffed animals, even if they're smaller, especially if they're solo kittens or 1 or 2 and they don't have their mother, something that they can nuzzle into really helps comfort them. The picture with the kitty in it is an idea that I come up with, and I'm sure it's probably been used in other places. But my little foster room that I have to set up large dog condos or large dog crates and use those. And the kittens, after a while, they get tired of being in those, and they get to come out and play when I'm here, but when I'm not and I have to go to work, they have to stay in them. So I went to the Dollar Tree and looked around for baskets or some type of container that they could get in. Some people use the large, they look like milk crates, but they're plastic. These are a little bit smaller and they hang nicely on the doors. I use the reusable zip ties so I can take them off and clean them. But they will play in them and jump off of them. And I hang 2 or 3 of them up in their kennels so that they have some extra vertical height stimulation. So we're transitioning a little bit to their wellness. We all know common sicknesses with kitties: diarrhea, which could be bacterial, parasites, dietary change, upper respiratory. No one wants to even hear those words, but we all know it's common. And unfortunately, fading kitten syndrome and ringworm. I think we could all talk about different things like that. I hope that if y'all are seeing ringworm in your shelters, you're not euthanizing them because of it. I do have a link for resources with that, and I'm happy to help walk you through any training with that, because that is definitely not something kitties or dogs or anything should be euthanized for, but that's for another day. Routine ways to help: of course, try to establish a deworming protocol. Work with a veterinarian to help you with these things so that these simple ways of protection can help them. Fecal floats, if you've got a technician or an assistant, or anyone can learn how to identify them if you've got a microscope and the supplies to run fecal floats. Hydration, we've talked about that. Sub-Q fluids and or IV fluids are true lifesavers for these little guys. Preemptive probiotics, we always try to get probiotics started in the kitties and mix it into their food as long as they're eating it. If it's to the point where they eat a bowl of it and then it doesn't have the probiotics versus the bowl with the probiotics and they walk away from that one, it's not worth them not eating to get the probiotics in them. Vaccination protocols, that's also something you should develop with your veterinarian. Educated staff, volunteers. Simple way to eliminate a lot of sicknesses is just taking the time, maybe 30 minutes or an hour after work, or send them a link and ask them a couple questions throughout the video of what they had to watch. But PPE and sanitation is game changer for a lot of these ailments that we see with these little guys. Of course, it's always nice to find kittens that kind of match one another with size or weight, but we've got to be super careful with that, with mixing them either before they've been tested or before we've had time to vaccinate them. Just be careful. And some fosters like to take multiple litters or multiple kittens. I know that they get tired of me saying, but like, don't mix them. Just keep them separate, at least for a couple of weeks. Make sure they don't break with anything before we try that. And then we talked about restrict mixing litters, but train the staff to properly identify and treat ringworm. We'll talk about that if you guys have any questions about that. So these are just some items that are really important. And of course, the PureVax, any type of vaccines, you're going to have a veterinarian to help you with ordering those. PureVax are nice. They're supposed to be safer with less preservatives. Rescue, you can actually order on Amazon. You can order through a veterinary distributor, which is probably more cost effective, but that's probably your top-notch cleaner and disinfectant for shelters if it's used properly. So if you're using this in the shelter, just remember, or maybe go back through, make sure you've got measurements up, and make sure your staff is actually measuring it out into the bottles, and they're not just dumping a little bit in here, pouring some in the mop bucket. You've got to make sure your concentrations and your ratios are correct, or you're not doing any good. Pyrantel is something pretty easy to get your hands on to at least give some dewormer to these little guys if needed. So these are some of the resources that I was talking about that may be nice to check out. The ASPCA Pro PPE and shelters, that is a great video to just watch to kind of put in perspective how you would wear it, or why you need to put one layer on or a certain product on before you do this, so that you're not already in there and then contaminate that location. Shelter sanitation, that's a great one to follow by. Ringworm and fostering, beating ringworm, feline upper respiratory planning, that's really nice. It's got some step-by-steps and some protocols to go through. Same thing with the URI. And then the diarrhea protocol, it's also one that has some steps that you can follow, or ways you can sort of an outline for shelters to go by. And I do trust these, and I think that they're constantly changing, and there's always room for improvement. So just, even if you've been involved with shelters a long time, constantly check back or continue to learn and educate yourself. There's so much that each year I try to get better with the amount of kittens that we see and protect them against what we've seen the year before. So just keep that in mind. Wish list items, these are just some things that I personally use a lot. The Miracle Nipples, Underweather Gel, and the Royal Canin, those are a little bit more pricey. I believe the Under the Weather Gel was like $18 a tube, but that tube's pretty big and you can get quite a few syringes out of that. But the Miracle Nipples, if you're not using them with bottle babies, definitely give them a try. Even if you buy one pack and just try them. We kind of keep a hidden drawer of them because they are like sacred around our shelter. Boston Rounds, like the one on the picture in the previous slide, K-Rose syrup. Nebulizers are another really good idea, especially if you've got kitties in the shelter that are sneezing or have respiratory concerns, or even with fosters. You can simply fill it with saline, which you can buy bottles of saline online as well, or probably at the store. But you can do about 10 cc's of saline, put them in a cat crate, cover the crate up, let it run for about 10 minutes with that nebulizer going, then let it sit for 10 more minutes so that they can breathe in everything that has been put out into the air. And that will sometimes help them with respiratory or congestion issues. Kitchen scale, like we talked about, just make sure it's in grams or ounces. You can usually find them on sale for about $25 on Amazon, and those are pretty good. KMR or other kitten milk replacement products, but that's usually your best bet as far as pricing goes. Probiotics, there's a wide selection of those. You want to try to find more of like a bulk selection. Of course, like Fortiflora is wonderful. Everybody loves it. It does get kind of pricey though. So they make some in like tubs that you can scoop out and add to the foster bags in little containers. Snuggle safes are great to ask for. Syringes, kitten food, canned chicken, or like any type of chicken, the body can break down those proteins a little bit easier than other foods as long as it's plain. You don't want to have it seasoned or anything. So not everybody's going to go out and buy chicken, but if you have a couple cans that you could put in each foster bag, so if they were to start having diarrhea or they were to start acting like, this food isn't very good, I need something a little bit better, they can chop up the chicken really fine, pour some of the broth onto the plate and offer them that. Crates are never a bad idea. Just make sure they're the ones that are safe and that stay locked. If you have any concerns, always zip tie your crates so that nothing gets loose. The reusable zip ties are great because you're not wasting so much and you can reuse them. Heating pads, I prefer the ones that don't have the auto timer because, you've got to go to sleep and the timer cuts off after a couple of hours. You're having to get up every couple of hours as well. Wi-Fi cameras, you can catch them on sale for like $30, $35. If your fosters have to go to work and have to leave them, it's a great way or a great peace of mind for your fosters to plug in, watch them, make sure that they seem okay while they're gone. Even in the shelters, if you've got one or two that you're concerned about and you've got to leave them overnight, at least you can lay eyes on them, plug it up, log in, check them out a couple of times after you get home. Toys, stuffed animals, you can pick those up pretty cheap at thrift stores or such, and Feel Away diffusers. Again, I'm all about cost effectiveness, especially when we all know that we do not have a lot of money in animal medicine and especially in shelters. So thrift stores, look for blankets, tube socks for the rice socks, saucers or small plates. Dollar Tree, check out the baskets. Anything will work. You just want to make sure the holes aren't big enough for them to slide their heads through or get caught or anything like that. So just keep that in mind. The more solid of the baskets, the better. And then, of course, talk or work with local hospitals, nursing home facilities. Even we have a lot of RNs that will call us and ask if we can take donated items, or people who have had procedures done and they're sent home with like home health and they get a lot of saline flush syringes or the gowns that are like toss or disposable gowns. Can y'all hear me okay?
Yep.
Okay.
Why?
I don't know. It said it again. This meeting is being recorded. And then of course, the one nice thing about like certain nursing home facilities, when they get those absorbable pads that, their patients are on, at a certain point, they have to throw them out. And, some of them you may not want to deal with. They may be gross, but if you have the means to be able to wash and clean, the absorbable pads are great for kitties with diarrhea or just having an extra layer on top of your nice soft blankets, especially if they're really messy. Grocery stores, never hurts to ask if they can donate food. We have a Kroger that donates like ripped bags, and we just have to go pick it up once every 2 weeks. We can go pick up the food, and it helps with our community pantry, our food pantry. And then of course they're nice, and alcohol ABC stores are nice as well for boxes, or like the cardboard litter boxes like we talked about with the short sides. Those are really good if they can save them for you on a weekly basis and have someone to pick them up. It's one less thing you have to wash or clean, especially if you've got a lot and you don't have a lot of resources or manpower. and toss those cardboard boxes and just refill a new one and keep it moving so that you're not worried about the litter scooper or the litter pan being possible contaminant. Okay, so I think that is all for now. I'm happy to answer any questions, or if y'all want to talk about anything, feel free to ask me. I can send you my info. There's so much to talk about on this topic. I try to hit the things that I see every day that you got to just, it seems so simple, but a lot of people forget about.
Stephanie, could you send out the, or send me the resources slide and then I can share it?
Yeah, I can send it to you. I don't know if the one is on there. I know this is off topic about the ringworm, but it still blows my mind that it's such a sad topic to face. But there is a really nice resource for treating ringworm and learning about it that it's called the SPORE program. I'll try to find that. It's really hard to figure out how to get the link to, but it is a great, it's like a training module that you can go through and it's free. So I'll try to find that as well and send to you.
Okay, thank you.
Mm-hmm.
I know everybody's muted, but if anybody has any questions, they should be able to unmute themselves, or I can try, or they can put it in the chat. It's very informative. Thank you for doing this.
Yeah, I just saw the, someone had posted that they missed the first few minutes asking about the K-Rose syrup when they're not eating. Yeah, so the K-Rose syrup is just a really concentrated sugar supplement, so it's nice to have on hand, especially when they're not eating or when they're so small, because it doesn't take much for their sugar to drop very quickly, and it's hard to get them back. And I'll put my email in here too if any of y'all need any. If you've got anything you want to ask, I put it in the chat box.
Marcia's asking if we can get a copy of the slides. So I don't know
Yeah.
if you want to send the whole presentation to me, and I'll just share it out to the attendees.
Yeah, I'll be happy to. Do you just want me to email it to you?
Yeah, that's fine. And
Okay.
I have the email addresses, so I'll just send it out to everyone.
Okay.
And this will also be posted on our YouTube channel, which you can
Oh.
always get to at the top of our website, the header on all of our website pages. So all of our webinars are posted there.
Cool.
I love the basket idea. I never thought of that idea.
Yeah, that was really neat.
Mhm.
It was sweet last year when we went to the Dollar Tree like on a Friday night, because I was just like, I've tried boxes and they jump on the boxes and they crush them. And we went to the Dollar Tree on a Friday night and we're out there, we get back and we're out here trying to set the, like slide my fingers through the holes to get the zip ties connected to them. And the kittens are already looking like, I don't know what this is, but this is going to be fun. And I hung a little toy from it. Oh, it was on. They were like, it was like leapfrog. They were hopping from one to the other in the kennel, and they loved it. So they are fun to have. You just, if they're really little kittens, or not really little, because I don't think they're going to be able to get in it, but 6 to 7 weeks, and they're about to the age where they're really playful, you might want to make sure they're not all really high up. So if they jump, they don't hurt their legs.
Oh, okay. Perfect.
It's amazing what you can find at the Dollar Tree, isn't it?
Yeah.
Yeah. I love when people have great ideas like that. I liked, this was very informative. It was also reassuring for us that are doing most of those things that, we are doing the correct, we are doing correctly.
It's hard to know. I think every day it's a whole new learning process, and you see like so many, we see a lot that come in from either other shelters or from people who surrender them that are flat out, they're ice cold, they've got fleas crawling all over them, and a little bit of this knowledge, something so easy could have helped them. So I hope it helps somebody, help a critter somewhere.
I like the foster part of it too, given these ideas for what to send to fosters, because that's really helpful.
Mm-hmm. Yeah, it is, because most of the time, if you can prevent the kittens from being at the shelter, you're eliminating a lot of exposure to things that they don't need. So your fosters are a great asset.
Anyone else have a question? I guess not. So thank you again, Stephanie.
Oh,
Thanks, Stephanie.
I hope it helped you. Thank you. Y'all have a good evening.
You too.
All
You
right.
too.
Thanks. Bye.